Welcome everyone. Myself Dr. Stavin DS. I'm MD in Gynecology and Obstetrician and MD in Endocrinology Surgery and Infertility. Today I have come here with my second particular video about the menses, its related problems and what are the solutions. We as everyone knows, a girl faces this particular problem in her lifetime. Then there are different problems associated with the menses. So I thought I will come up with this particular presentation to highlight some of these particular problems faced by a girl or a woman in her womanhood phase. With a good response from all of you from my first particular infertility video and based on many requests that has come up for this particular topic, I thought of doing a good video on this topic, and that's what I'm presenting here to you on this particular topic. Now, I feel this particular picture says it all. Each particular girl should be happy to bleed because once she particular starts her menses, that is the particular transition that takes place in her particular life from adolescence phase to a next particular phase of a womanhood. That means her body is now making herself ready for her to conceive or to become a woman. So this is a next step in her particular journey of moving from adolescence to a womanhood. But there are different problems, there are different challenges also associated with this, and that is what I'm going to address in this particular session. So what I'm going to discuss? I'm going to basically discuss the topic, what is menses? Still, many women doesn't know what is menses. So I thought of explaining them what is menses. Further, I will also discuss when you get your menses, why you are getting it, and what is the purpose why you see a particular blood during your menses. Next important questions always a woman asks is, will their particular menses will be regular? Other question that comes is, if my bleeding will be consistent always, so throughout my life, will I always be having a regular period or regular menses? This also needs to be addressed. A very important question that comes is, what if I don't get regular menses? That is also to be addressed. And if I don't get regular menses, is it going to affect my fertility? Or will I be able to conceive if my menses is irregular? So all these topics are very important, and it is quite common in many particular girl and woman, and many a times they don't particularly share this problem with the doctors or their family members, and simply the problem increases. That's why I took up this particular initiative to make them at least aware regarding what is happening inside their body. So at least by looking at this particular video, they will understand what is actually happening and why they are getting particular menses. So I feel as a new generation woman, each one of you should know this and just understand the particular process and try to observe the signals that your body is giving. If any sort of abnormality is observed, then you will be able to catch it up very fast and you will be able to refer to your doctor on a right time. Anytime I always tell my patient is the time at which you approach a doctor is very important. More early you approach, we have a better option of treating you. If you come late, then definitely there are less options available to treat you. But I'm not discouraging you. The whole idea behind this is to make you aware what is happening during the menses, what are the problems associated with it, and what are the symptoms that your body will give you to different problems. So if you find those symptoms, definitely you can approach a particular girl or a doctor, and then or otherwise you can also approach me online. So having identified the topics that we are going to discuss here today, let me go to the topics one by one. So what is menses? The picture here says everything. There is a girl who is having her periods, and by now I know that most of the particular girls are using sanitary pads and have switched over from the traditional approach of using some other material. Usually, I would still prefer many particular girls using a cotton sanitary pads, which are also okay, but hygiene-wise, you need to take little bit care of it. Now, what is menses? It's a vaginal bleeding that occurs as a part of woman's monthly cycle. So every woman knows that it is a blood that is coming out from her vagina at the end of the month, and that forms your cycle. Now, my next point indicates why you are getting the particular blood coming out from your vagina. So, what happens is every month a woman's body prepares for a pregnancy. So, the woman's body is preparing herself ready to become pregnant. And if there is no pregnancy that is occurring, so if she doesn't get pregnant in that particular month, then the uterus sheds off its lining. Lining means there is a small wall inside the uterus which was preparing the woman or which was preparing the uterus for the pregnancy. And if the pregnancy doesn't happen, then that lining gets shed off, and whatever things that comes out is nothing but what you see in terms of a plain blood or in terms of the clots. So this is a particular reason why you get your particular monthly periods, and what you basically get is the blood that is coming out of it is basically the shedding of the inner walls of the uterus lining, and that's what you see in terms of a blood or the clots that you see during your discharge during the menses. Now the menstrual blood is partly blood and partly tissue from inside the uterus. So this partly tissue is referred to the clots that many of you basically see when you have the menstrual periods. So this slide makes it clear is what is menses, why it is occurring. It is because your body is preparing for the pregnancy, and if the pregnancy does not occur, then definitely the inner lining of your uterus is shed away by your body, and that shedding part is nothing but what you see in terms of the blood, and the partly tissue, which is nothing but you see basically it as a clots. So this gives you a fair idea like what is your menses and why it is happening and what you observe coming out of your particular body towards the end of the menses. Now let us go and do this. Now many a time when I ask particular patients about do you know the internal structure of your reproductive system, and many times hardly I would say 5 to 10 particular person woman knows the answer, whereas remaining 90% doesn't know even how the external structure of our vagina looks like. So we don't have the scope even in those cases of knowing the internal structure. That's what I was saying is the woman of this next century should know at least her own parts externally as well as internally. That's why I put the external structure of your vagina. So how it looks like is it has basically the three components, basically the two components. This is a particular hole from your urine is passed. And as I discussed in my infertility video, the women are at a greater advantage because they have a separate channel to pass the urine, which doesn't happen in case of a man. You can refer my previous video to get more explanation to it. So this is a particular hole through which your urine is passed. This is a particular hole from your blood comes out during your menstrual cycle. The same hole that you see here can also be used for penetrating the penis when you do the sexual activity. And the same hole can also be used for a particular baby to come out when you have a normal vaginal delivery. So you can imagine the extent to which this particular hole can be flexible because it can accommodate the entire baby can come out from it. So basically your vaginal will have this part. The thing that you see on top here, this called as clitoris, and many a times the woman gets more activated after touching this. So this is basically a particular section which is sort of an activation center in case of a woman whenever they want to indulge in the sexual activities. Of course, there is also a spot called as the G spot, but that is basically inside, and I might do some session on that particular topic as well in some later sessions, but that is not for today's discussion. We may have also one hole here that is called as the anal opening that has been passed basically used basically to pass your stools. So basically we have in women three holes, that is the urinal urethra that has been basically to pass the urine. This is for passing the period blood as well as for the baby to come out. And the third one that you will find here that will be the anal opening where it has been basically used to pass your stools. Now every woman I recommend those who have not at least explored this part of a vagina, please keep a mirror in front of your vagina and try to have a look at your own vagina. Apart from this, you may also have these walls. They are called as the labia, minora and majora. So this is a majora, the outside one. This is the minora, that is the inner one. And basically you might have to just open up little bit of those particular lips. And it is again, different women have different vaginal structures. So you may have to simply little bit open up to explore this particular region within yourself. So having seen the outer structure of your vagina, let us now go into the next slide and try to explore more in detail. So everyone has seen from the external world. I would like to take you to a little bit in the interior world, and which I feel every woman should know in detail. So the thing that you have seen in the previous slide is only this part which is visible from outside. And it has the labia majora, labia minora, that is the outer lips, what we basically call. The clitoris is the top section, which is nothing but this. This is your clitoris, which is a good activation center whenever you indulge in the sexual activity. Next is this is inner channel. What you see is the vagina. This is maybe about 5 centimeter inside. So this is the vaginal canal, what we basically call. Then you have something called as the cervix, that is over here. Many times you might have heard about the cervical cancers or something, pap smear test or something of that sort. So we basically take the particular sample from here, that is called the cervix. After cervix, inside, we will find this section, that is uterus. So this is the place where your baby is born, and also the preparation is done by your body for the pregnancy. Further down the line, you have the uterine tubes, which we basically call it also as a fallopian tubes. So these brown color tubes, what you see here, they are also called as the fallopian tubes or uterine tubes. And further, this white color thing that you observe here, these are called as ovaries. So you have two ovaries on two sides. So this is how your internal female reproductive organ will look like. So this is the external view. What you see is very small, but you can just imagine how dense it is internally. So this same diagram I represented now in the viewpoint over here. So this is the vagina, so that you see the vagina here. This is going to be the cervix, this region. The cervix which you see here will be this region. And this is going to be uterus, and this is going to be that uterine lining which I was telling you before, why you get your periods. So this is that lining which gets shed away if the pregnancy doesn't occur, and that's how the blood comes out from here and you get your periods. Further down the line, these are the fallopian tubes, or which are also called as the uterine tubes over here. So these are the two fallopian tubes or the ducts that you see, and here you have the ovaries. So these are the ovaries which are highlighted here, are nothing but these two ovaries. So having known this structure, now we need to go into the details of it. So basically remember, you will have vagina, you will have cervix, you will have uterus, you will have fallopian tubes, and you will have your ovaries. Now, let us ask the next question is, when will I get my particular periods? Now, nowadays, there are different ages wherein a girl may start with her first period. I've seen a particular girl as young as 9-year-old having her first period. And I've also seen a particular girl who has not received her period also till the age of 15 or 16. So if you don't receive a particular period till 16 years or something like that, then there is a need to worry and you need to immediately consult your gynecologist. Having a particular period as early as 9 is also not a good sign, but still it is accepted because of the change in the food habits and the environment through which we are going. So I've put up here a particular picture wherein there are girls of different particular age groups and they have received their particular first period in this particular time slots. Now, one more point I would also like to make a mention is whenever a girl starts with her periods in her adolescence phase, definitely in the initial 1 or 2 years, the periods are not going to be regular. There will be a lot of irregularity in the period that will be observed in these first 2 particular years. So we need to give them time to settle off and let their particular body settle off. And then maybe after a gap of 2 years, then if still there is inconsistency in the period is observed, then you need to consult your doctor. So the inconsistency might be a delayed of period by 2 months, 3 months, or you may have only small spotting for a particular month without a full flow of the period. Or you might also have a cramp like cramps, or you may feel a particular body changes that is occurring, but definitely you are not getting your periods or the blood is not coming out. So these are quite normal in the first 2 years, but if the problem persists beyond it, then definitely you need to consult your doctor at that particular time itself without much delay. My next slide on the right hand side indicates what happens during your periods. Now by now, all of you are familiar with this internal structure of your vagina. And as I told you before, I defined your period occurs because your body is shedding off the lining, the uterine lining, which it has prepared for the pregnancy. And if the pregnancy doesn't occur, then this lining is shedded off, and that's how you get your periods. So explicitly what you see here is in the menstruation phase, that is the first way named here as a menstruation phase, wherein actually you see the blood coming out from your vagina, which is nothing but because of the shedding of this particular lining which is produced inside it. Now I will come back to this particular uh, point somewhere later after explaining all of them. So basically, remember in the menstruation, the blood comes out, and the reason behind it is shedding of the inner particular lining of your uterus. Now let us go to the second phase. Now, what we do is in the second phase is basically every month your body, a female body, is producing an egg. And we say if a fertilization of that egg with the sperm, which is nothing but coming from a man after having the intercourse, if a sperm is able to fertilize the egg, then we say a particular woman has conceived and the pregnancy has started. But if this doesn't happen, then whatever the preparation that was done for the pregnancy is being shedded off. So now it is important to know how that egg formation takes place and when it takes place. So basically, you have the first phase, we basically call it as the follicle phase here, wherein there are something called as the follicles inside your ovary, which are responsible for producing the egg. So you have two ovaries here, and there are going to be some follicles inside it, and they will be basically producing the egg. So this is a follicular phase wherein the production of the particular egg takes place. Again, my detailed particular slide in next slide will also explain it in more in detail. So to brief you about, there is the follicle production here, that is a production of the egg. Then what happens is so this particular lasts about 7 days. Next phase that comes up is called as the ovulation phase. Now this is the time when, if you observe here, the egg is released from this ovary into your fallopian tube. And basically we say this, if your period is regular of 28 days, then this process may start somewhere on the 14th day from your start of the period. Now, one more point I would like to make a mention here is, let us take an example wherein a woman has a regular 28-day cycle. Now again, I would say every woman may not get her periods in exactly 28 days. Some may get in 26 days, some may get even in 32 days or 34 days. So any woman getting her monthly period within this particular window is considered quite normal, or a periods can be also considered as regular periods. But any woman whose periods goes beyond this particular window of 34 days, then definitely they need to be treated as irregular periods, and the consultation needs to be done with the doctor. So let us consider a standard procedure that a woman is having a period of 28 days, and if this bleeding starts on the first day, let's suppose, of a month, then the bleeding may continue to a maximum of 6 to 7 days. In some women, it can also stop in 2 days or 3 days. That is obviously no problem. But maximum it can go to a particular 6 to 7 days. So if we assume that a period is starting from first day of a particular month, then this process will get over by 6 or 7 month. Sorry, 6 or 7 day of that particular month. So this process, that is the next one, that is called as the production of the egg, will last till the date 10 or 12. Then the third phase which comes up is ovulation phase, wherein this egg which was produced before gets released over here. This usually we term it as ovulation, and there are different symptoms related to the ovulations as well. So this usually starts from the 14th day. And whenever any couples they are trying to conceive, we basically advise them that you need to have your sexual activity during this phase. And this particular thing lasts for about 3 to 4 days maximum. So a fertile period in your case may be from 14 to a particular 18 or 19. That is the time when this particular egg which is released here is going to traverse through a fallopian tube like this and is going to come and settle here. So anytime during this activity, if you are trying to have a sexual activity, the sperm can also move in this particular direction and can fertilize the egg over here. So ovulation phase is the important phase when any particular couple trying to conceive, and it needs to be taken seriously. The next phase is called as after ovulation is the luteal phase, wherein if suppose a fertilization takes place with the egg and a sperm, then the zygote what we basically call will come down here and it will attach itself to the uterine lining. But if the fertilization doesn't take place, then the egg simply comes and waits here for it to be fertilized. And it waits there, it can stay there for about 3 to 4 days. If it doesn't find the fertilization taking place during that time, then ultimately the body prepares to shed off all the lining that it has prepared, and that's why you see the blood coming out of it. And along with that, the egg that was not fertilized also passes away from here. So if you see here, along with your blood, you may also find an egg. Many a time, a woman may find a little bit of clot with a dark brownish thing coming out, and immediately after that clot you will observe that the flow of your menses gradually decrease. So that is nothing but the egg that is being passed out, which is not fertilized. So one more point that I would also like to highlight in this diagram, if you observe here, the shedding of the uterine wall has taken place. In this particular next phase, follicle phase, this lining, if you see here, your body is building up that lining to prepare yourself for the pregnancy. At the same time, the production of the egg is also taking place in the ovary. That's what is your follicle phase all is about. When you go to the next phase of the ovulation, this lining, if you see, has thickened compared to here. So this lining has become more thick. And further down the line in the third phase, that is the luteal phase, if you observe, this lining is much more thicker compared to the previous two cases, wherein it is now waiting for this egg to come and settle down here and waiting for it to fertilize. Or if it was fertilized before, then it is waiting for it to come down and settle down here from where the baby can be born if it is fertilized. But if that doesn't happen, then all this particular lining needs to be shedded off along with the egg, unfertilized egg, and that's what you basically see here. That is, along with this lining that is shedded off, the egg is also passed out from your vagina during your discharge. So this is what basically happens in a 1 month cycle, and that's how you get your periods, and that's why your blood comes out of your vagina. So this is the internal flow, why, and you should know that why you are getting the periods and what is the reason behind it. So the same thing I also made it more clear in my next slide is what are the signs of the periods. So we'll come back to that slide little bit again. But first, what are the signs of the periods? So if you ask me, the early signs for your first periods will be definitely a girl in the adolescence phase will observe changes like there is a change in the nipple and there is also a change in the breast. and you may find more tenderness in your breast when you are going to get the first period, and also for your subsequent periods, you will also observe the same thing. But these points I've highlighted from the perspective of that particular girl who is going to observe her first period. Next thing, you will also find the appearance of a more thicker pubic hair that tells you that you are more matured. You may also find the PMS syndrome, that is premenstrual syndrome. That is, you may find the cramps in your abdomen. Sometimes the cramps are unbearable. That the time we prescribe them some alternate medicines if it is unbearable. Otherwise, they are bearable, and once the period starts, gradually these cramps goes. Girl may also find some vaginal discharge in her panties prior to the start of the period, or she may also observe some sort of a spotting, some sort of initial drops, and you need to tell your particular patient, or you need to tell your particular daughter, nothing to worry about. This is a normal sign that is happening, and you are now you are going from one phase to the other phase. So good support to that particular girl is required during this. And along with it, there are also other changes, like there are some mood swings, which I'm going to discuss over here. So these are the prominent features that a girl may observe during her first period. So a good emotional support is required for that particular girl. So she can be either consulted to a doctor who can explain her, or if a well-educated mother or any relative is present at home, she can also provide or give good guidance, or might be also a teacher in the school can provide the guidance in this particular phase, because this is very critical phase for a girl in her adolescence regime. On the right hand side, I listed down all possible symptoms that any woman can also get during her periods, including this particular girl. So some of these symptoms that you see here are also common over here. So one is definitely the acne, that is your pimples. So these are more prominent in the girls in adolescence phase rather than in the later state. So a girl may find a pimples. A girl may find tremendous back pain. This is a common symptom as well. A girl may find a bloated abdomen. You may pass a lot of gases. You may find something moving in your bowel movement, and that is also a common sign when you are approaching towards your period. You may also find a lot of craving for your certain foods, maybe like ice cream, or maybe like a coffee, or maybe like some food that you like. You may find a lot of craving for certain foods. This is also quite common. You may also find a lot of constipation that is taking place, because this is also related to a bloating problem. So many girls can also feel a constipation. So we advise to have a lot of intake of the fluid during this phase, so this problem can be sorted out. You may also find a lot of crying spells. Uh, uh, a girl may be a little bit emotionally disturbed during this particular phase, and there might be a lot of emotional swings that you also see over here. So there might be mood swings possible, and they are quite obvious during this phase, and that is happening because your body is going through the hormonal changes to bring about all these things what I explained you. The underlying thing are the hormones that are responsible that gets it done, and definitely because of that you may observe a mood swing, and these cry spells are also a part of it. Further, you may also find a little bit increase in your heart rate. Of course, many a times a girl as such may not notice it, but a woman in her late ages may observe increase in heart rate, or if any woman has some heart related issues, it is more evident that she may observe this. Next one, you may feel irritable, tense, and anxious. So you get irritated quite easily. You also get tense on little issues, and the anxiety factor is also associated during that particular phase. Next, you may also feel a lot of tiredness because you are losing a blood in that particular phase. So you tend to become more anemic in that particular phase. So tiredness is also observed prior to particular menses as well as during the menses phase. You may find increase in your body temperature, so that is hot flashes. You may find substantial amount of pain in your joints, leg joints, hip joints, arms, hands, and so on. You may also find a substantial amount of change in your breast in terms of its tenderness. It is going to swallow. You may also find changes in your nipples as well to some extent. So these are quite normal changes. And I always advise all the women during this phase, always try to wear a particular bra which is a little bit higher in your size compared to what you are wearing before during your non-flow particular period. The other particular changes that you also find here is you may find a lot of difficulty in concentrating on one particular thing. So a lot of concentration problems are also associated. So basically this concentration problem, mood swings, crying spells, irritability, all are related to one hormonal changes. And because of that, all these problems may occur. You may also sometimes find swelling in your hands and in your feet. It is not common in all the cases, so you may find this particular changes as well. So if you get it, then you can treat it for that particular time being. It may be associated with your periods. Second thing, you may also, because of emotional feelings, you may also find to be alone. You don't like the company of the others, and these are quite normal feeling during it. Or you might also be shy because you are getting a period. What if they come to know that I'm having a period? So that also brings some sort of the shyness in a particular girl, and she prefer to stay alone. Then the next one is your weight gain. Sometimes you will find that you have definitely gained some amount of weight during this particular phase, and that is also quite obvious. Now, again, all these particular things, what I listed here, are probably the symptoms. All of you may not observe all the symptoms, and some of you may observe all of them or some of them. So I listed all of them, all the possible symptoms that you can get. So some of you may observe a part of it, or some of you may observe the majority of it. So there is nothing wrong in it. You need not observe all the symptoms during your periods. So having defined this, I go to the next slide and come back. So this is a sort of a tabular representation of what we have discussed here. So what we have discussed here is now tabulary represented in terms of a chart over here. So if I have a typical 28-day menstrual cycle, which I had explained before, then if I say my menstruation starts on day 1, the bleeding starts on day 1, and usually remember your menstrual cycle is counted from the first day you get your bleeding. So if it is starting, suppose on day 1 of a particular month, just an example I'm taking, then it may continue till day 7. So you may have a 7 days window for the flow of the blood. It's not necessary that all of you should get always 7. Some can get 2, 3, some can get 4, 5, and so on, also possible. So if someone is getting, say, of 5 days, then this particular window which is there, it gets shifted slightly here. So as I told you before, after the particular bleeding has stopped, your next phase is also what is happening is your follicle phase. Now, basically, if you see here, the follicle phase is marked right from here, that is when your bleeding takes place, until here, till it is being released, till the egg is being released. So, what is happening is there is an overlap between your particular bleeding as well as this follicle phase, what you see. So, the indication of it, what it basically means is when you are shedding the blood during your menses, at the same time also the production of the egg continues in the ovary. That's why there is an overlap between this menstruation particular phase as well as the production of egg, which we basically call it as the follicle phase, and that's why you may find the overlap over here. Then once you're stopped with your particular bleeding, then these are the particular days which I was talking about wherein the ovulation can occur. And always I recommend my couples who are trying to conceive, try to have a particular sex right from day 8 onwards. So you have a possibility to conceive here because from different women who have also the irregular periods, trying to identify this actual window period becomes little difficult. But if you have a regular period of 28 to 30 days or something like that, then definitely you can easily compute this particular window. So ovulation phase is that phase, as I told you before, is when the egg will be released into your fallopian tube. And there, in that particular phase, there are very high chances that you can conceive. So basically it goes from day 10 to day 14. So we basically recommend the patients to have a lot of sexual activity during this particular phase. But you can also continue a little bit here till this, or you can also start prior to here over here. because some of the woman, if their period was of 5 days, then this particular window would shift somewhere here, and your ovulation may start somewhere 8 to 9 day onwards. So that's why we basically recommend to have the sexual activity in this phase. This is more prominent. You cannot avoid it as such during this phase, and also possibly you can try at this phase as well. So this is your ovulation phase window, what I was talking about. And after that, we term it as the luteal phase, wherein now the egg after fertilization may have come to uterus, or if the egg is not fertilized, it is still in the uterus and waiting for the fertilization. But then what happens in the luteal phase is there is more thickening of your uterine lining. And if you try to conceive, if you try to do the sex activity during this phase of your particular cycle, definitely the chances of conceiving are very less, because the egg has already reached the uterus, and the chances and some other particular things that also happens in that particular egg, wherein it prevents the particular chances of fertilization. So your ideal window that you need to take care if you want to conceive or if you want to prevent the pregnancy is this window. So it is both the sided. The girl who is trying to, a woman who is trying to conceive, for them this is very important. And for the couples who are avoiding it, they need to also either use some sort of a contraceptive if they want to indulge in sexual activity during this particular phase. Whereas the safe period will be this and safe period will be this, provided your particular a woman is having a regular 28 to 30 day cycle. But if there is irregularity in this, then this particular dates might slightly alter. So don't follow exactly this particular dates. What I would say, this is for a regular sort of 28-day cycle. Plus or minus 2-3 days may happen in each case if some sort of irregularity from 28 to 30 days or 32 days cycle is being observed. So each case needs to be treated separately. And whenever there is ovulation that takes place in your body definitely sends a sort of the signals. You may one prominent signal you may find is a change in your body temperature. So always I also tell my particular patients to always keep track of their body temperature right from day one. So here usually you will find your body temperature is consistent. And here suddenly when your ovulation phase comes, your body temperature shoots up by some zero 0.5 degrees or 1 degree. And it remains over there for some days. So that is a time that it tells you that you are in your ovulation phase. Plus, apart from it, there are other symptoms which are also given by your body, like there is a milky discharge that is happening through the vagina that is not having any odor. That is also an indication of that you are ovulating, and the ideal time has come for you to indulge in the activity. This is again the menstrual cycle which I had explained before. Is also I put up one more diagram. So this is the menstrual phase wherein you are bleeding and shedding of this lining takes place. Next phase, as I was telling, is a follicle phase wherein this egg, if you see, is developing. Next phase is the ovulation phase wherein that egg which was developing here gets released into your fallopian tube. So it is traversing now through the fallopian tube that you see. And next one, that is a luteal phase, the last one, wherein the egg after traveling through this fallopian tube has come here. And if it doesn't fertilize here, then along with this lining that has been developed, the egg will also be passed off. But if it gets fertilized, then definitely it will grow and it sends a signal to your body not to shed away this lining. So this lining will be then used to for the nurturing of the fetus that is developing here. And as such, if you are conceived, then definitely you will not find a particular period for that particular month. So you have missed a particular period, and henceforth, for say 9 months, if your pregnancy goes smooth, you will not find the period for the 9 months, because now the uterine lining is preparing itself for the growing baby or growing fetus. So this is how your menstrual cycle usually works out with the phases: menstrual phase, follicular phase. So you should know what is happening here. It is ovulation phase and the luteal phase. So these four phases contributes your 1 month cycle. So now I would like to discuss what is that particular thing that brings about the change in your body in that 1 month. And basically, they are nothing but an important role is played by your hormones, in which we basically call it as the endocrine system. So your body has different particular glands which produces different hormones, and because of all these hormones, you get your monthly cycle. I'm not going to go into the details of it, but I would like everyone, every woman should know which hormones they are producing, because many times when they approach a doctor, the doctor tells them to do the test of some hormones. So at least they should know the names of the hormones and basically what contribution that hormone has in the menstrual cycle, or how important is that hormone. So first one is a follicle stimulating hormone, which we basically call it as FSH. And from the name itself, it is basically used in the development of the egg. You have a gonadotropin, which is also a hormone, which is a part of this FSH hormone. You have luteinizing hormone or LH hormone, which we call, and further you have estrogen and progesterone. So these are four important hormones which plays a significant amount of role as far as the menstrual cycle is concerned. Apart from this, there are other hormones which a woman body also produces, which are not listed down here, like prolactin and so on, which are also contributing factor towards the entire pregnancy. So now look, coming back to your right hand side diagram, this is what is actually happening in terms of your body and in terms of your different hormones. So the first particular point that you see is the lining of your uterus. So this is the time when you are menstruating, the lining is being shedded off by your body. This is that phase. And also, if you observe here, the menstruation starts from this window. So your bleeding actually starts from here. This lining, what you see, are shaded off. So if you see here, that lining is going on decreasing. And once you stop your bleeding, the lining is minimal. Further, from that 7 day onwards, when it goes to the follicle phase, that time if you see, along with the production of the egg, here if you see the egg size is increasing at the same time, and whenever you're shading the particular lining, the egg is also developing. That's why I had said the follicle phase overlaps with your menstruation phase in my previous slide. So egg is also developing, and you are also seeing your periods at the same time, that is shedding of your blood. But once it has stopped, if you see, the egg has developed a substantial amount over here, and at the same time, your inner lining walls of your uterus, they are also now increasing in their size. That means your body is preparing here to receive the egg and for the fertilization and for the pregnancy purpose. Again, this is the ovulation phase that you come across when the egg will be released from that particular ovary into your fallopian tube. And this is the phase wherein it travels the fallopian tube. And if it doesn't get fertilized at this level, then ultimately at this, it remains like this and it will be shedded away along with your uterine line. So there is a release and there is a traversal of the egg from the fallopian tube. And this is a case wherein the fertilization doesn't occur and ultimately the egg will be released through along with your uterine line. So the observation that needs to be made is there is a thickening of your wall as you see. And if the egg is not fertilized, your body sends a signal that the fertilization has not occurred. And in the luteal phase, what you basically see is that this is basically your luteal phase. And then afterwards, the shedding takes place for those 7 days. So this is a menstrual phase wherein there is a loss of blood. This will be your ovulation phase. This will be your follicle phase wherein the egg is developing. Along with that, your uterine lining is also developing. This will be ovulation phase wherein the egg will be released and you see that substantial growth has taken place in the uterus as far as lining is concerned. And if it doesn't fertilize here, then ultimately it will be shed away along with this lining. The egg will also shed away. So this is the process that we had discussed before. Now in terms of the hormone, what are the hormones that happens? Like your LH hormone and FSH hormone, these are the levels. So at this particular phase, that is the ovulation phase, you will find there is a substantial increase in LH hormone. So basically the couples who are trying to test for the pregnancy, only one test that you know is a pregnancy test, which you do ultimately after conceiving. But to know your ovulation phase, there is also a test called as LH test or luteinizing hormone test. So you get a strips on which you can put your urine, and there is an indicator whether your LH level has increased or not. So when your LH level is at the peak, that is the time when you might have done with the ovulation, and that is the right window to have the sexual activity and try to conceive. At the same time, you may find in terms of FSH, that is a follicle stimulating hormone, it is also a contributing factor at this level till the production of the egg. And once the egg is released, then the job of both these hormones decreases. So if you see, both these levels of these hormones decrease once the egg is released, and that level will also become high in your next cycle, that is from here. So their contribution is towards till the release of the egg, and then gradually the levels will decrease. Whereas if you see the estrogen and the progesterone hormone, you will observe these changes. In the first phase, that is before the release, the estrogen is a dominating hormone and which is playing a quite critical role in this development as well as this particular lining. But then once the ovulation takes place, then it is the control of the progesterone. So progesterone, which was almost inactive in the first phase, suddenly after ovulation, it shoots up and overtakes your estrogen hormone. So this is a total window of progesterone. And at the same time, you will find that estrogen levels will also go down. And then in the next cycle, when it is going to start, this progesterone will go down here like this, and the estrogen will take over. So all this, both these hormones, they work in synchronize. At any given point of time, one hormone will be active, other will be sort of inactive. And if there is any imbalance that has been created by this, then definitely your menstrual cycle is disturbed and you may not get your regular cycle. So whenever doctor says there is a hormonal imbalance, it basically means that all these particular hormones which are shown, they are not working as per what they are supposed to work. And as such, your whole cycle gets disturbed and you may not get a regular cycle. The next one, that is the last slide that has been put up here, is the change in the body temperature, what I was talking before. So in this particular previous phase, you may find a consistent body temperature. That's why I always recommend my patients to always keep track of your body temperature from day one, even when you are menstruating. So when you reach day 14 or so, where the actual ovulation takes place, you will find a significant increase in your body temperature, maybe by 0.5 degrees or maybe by 1 degree. There is not a huge change in temperature. It may be hardly 0.5 or 1 degree. And then if you observe that the temperature remains like that for more days, then that is the time that you are ovulating. So this is also one of the indicators given by your body to find out when you are ovulating or not. So this is about the hormone. So what I expect you to know is the names of the hormone. Every woman should know at least FSH, LH, estrogen, progesterone, and this gives you a good indicator what is the role played by each of them in your menstrual cycle. Having discussed this, the next slide is very important, is will my bleeding will be consistent always? The first particular question that a woman has in their mind is, I want to have my regular periods throughout my lifespan, but it is always not possible. You are going to have the variations in it. Sometimes you may go into irregular phase and then you may come back to a regular phase and vice versa. So the important point that I would like to highlight is the color of your period tells much more thing about your health. Many times what happens is whatever the pad that you have used, we simply write it up and throw it in a dustbin without even having a detailed look at it. But I always advise my particular patient that please have a look at what you have released from your body in terms of the blood, also in terms of the clots, and please observe it minutely and keep a record of it, because that conveys a lot of information regarding how your body is functioning. So I just classified into sort of four categories. We'll go also in detail about it later. So this is the one where you may also find a small spotting. There's no much particular bleeding, and it might be light blood or pinkish blood. Here you may find little bit darker blood. Here you may find a blood with some clots, and here you may find excessive blood and lot of clots when it is mostly brown in color. So these are the four things that you may observe during your menses, but please have a look at it before throwing it in the dustbin. So I've just taken two cases wherein this case is this. sort of a pinkish discharge. And this is the extreme case wherein you may find a brownish discharge in terms of a lot of clots and a lot of blood. Now, based on this, I have classified it into three cases. That is, we basically, in medical terms, we call it as amenorrhea, wherein there is an absence of menses. There are no periods occurring in a woman. That is called as amenorrhea. Regular periods, a woman is getting a particular period, and the time frame may not be 28 days. It may be anywhere from 26 to 32 days or 34 days as well. But beyond that, you need to worry. If a period is going above particular 35 days cycle in a particular month, then definitely it is classified as irregular menses. And the next one is menorrhea, which is basically heavy menses. You have a lot of heavy bleeding, and something like this is menorrhea. Okay, so I'm going to discuss all these three things. Basically, the first and the last one in detail. The regular periods I already discussed before this. So, what are the symptoms of amenorrhea? The first critical symptoms is absence of the menses. Now, you are not going to get your monthly period, so that is the first indication of amenorrhea. What are the possible other symptoms that you may also observe along with this? You may find some milky discharge from your nipples. You may find a hair loss. You may find a constant headaches. You may also find some blurry visions. You may also find the excessive facial growth hair, which are not supposed to be there in girls. So usually we find that a man has excessive facial hair, so that is controlled by one hormone in a man. But if that hormone becomes more active in girl, then girl may also observe those changes in them, which was supposed not to have. So that hormonal imbalance can also be responsible for not having the periods. So, and this is the characteristic that your body signal is giving you because of that hormonal imbalance. You may find a lot of pelvic pain. So you may have the cramps as if you are getting the periods, but there is no discharge of the blood from your vagina. So that can also be a sign of amenorrhea. And definitely you can get a pimples or the acne on your face, or also on your particular body, or also on vagina to some extent. And those are also the particular indication of the amenorrhea. But the major contributing factor is the absence of the menses. And these are some supporting particular symptoms that you may observe in your body. Now, many times some patients tell me that they are not having periods and they find a hair loss. So many of you sometimes treat it because you have used a different shampoo or different soap that has resulted in a hair loss, and you keep on changing your soaps, but the problem still remains the same. So the problem lies with your hormones rather than that particular soap or the shampoo that you have used. So these are, I've highlighted some of the symptoms which may be observed in some patients who is having amenorrhea, and the most important one among it is definitely is the absence of the menses. Further, is when we discuss about amenorrhea, there are two different categories of it. The first particular category is called as a primary amenorrhea, and the second one is secondary amenorrhea. We'll go into this first. We call it a patient is having primary amenorrhea when a particular girl doesn't get her period as late as age 16. So if a girl has not observed any period till 16 years of age, then definitely it falls under primary amenorrhea. What are the possible issues related to this? The possible causes because of this could be because some issue in the pituitary gland. Now, in my previous video, I had explained all these particular glands. You can have a look at it from that particular video. So this is also one of the important particular gland that is basically sending the signals which ultimately goes to the different endocrine system and which are responsible for releasing of the different hormones. So if the problem lies here, so this is a gland basically present in your head, inside your brain, that area. So if there is a problem with that particular gland, it will stop sending the signals to the other particular parts. As such, you may find that it may ultimately result in missing of your periods. The majority of the issues lies somewhere here. Other particular issues may also deal with congenital defects of the female reproductive system. Sometimes there might be blockages which is preventing. Sometimes your ovary is not particularly properly formed. Sometimes fallopian tubes are blocked. Sometimes there is a cervical blockage as well, so that it doesn't allow the blood to come out and you don't see your periods. So these are some of the congenital defects that a female may have in her reproductive system from the birth. So that can also result in primary amenorrhea. The other particular reason can also be delayed puberty. If your puberty development is delayed, then sometimes this particular window also shifts, and definitely you may not see your periods at the age of 16. But any particular girl, I would say, who has not seen a particular period till 14 or 15 years should immediately go and consult the doctor to get the advice, first level advice, whether they are having this or not. The second category which we comes is the secondary amenorrhea, wherein a particular girl or a woman already had her particular periods, but they stop after some time and they are not observed for almost as long as 6 months or more. So in this case, the girl or a woman already had her periods for some time and then they suddenly stop and she is not seeing the period for more than 6 months, then we basically classify the problem as a part of secondary amenorrhea. And what are the possible causes? The possible causes is one of the cause is anorexia nervosa. Now this is sort of a disorder that is there in your brain, wherein your brain is acting as if I try to eat more food, then I may become more fat. So your brain is preventing you from eating a particular all the foods that you like, or what all the foods that you would like to have, and as such you tend to lose your particular weight, and that is ultimately affecting your other particular body parts. So this is sort of a condition wherein your brain is telling your particular system to avoid the food because of some other reason, and that is ultimately affecting your whole of the system. The next one is overactive thyroid glands. So if your thyroid glands are active, then they are going to generate more of your thyroid hormone, and the condition that we basically call is hyperthyroidism. So basically your doctor might suggest you to do a test, something called as TSH, not FSH. So it's a TSH test wherein we check the particular levels of your thyroid hormone and to identify whether you belong to this category, or that is also called as hypothyroidism or hyperthyroidism. So if it's higher, then you belong to the hypothyroidism that is over here, and it is also a major cause of secondary amenorrhea. Other reason why you may not get your period is also because of the generation of the ovarian cyst. So there might be a cyst in your ovary, and because of which you are not getting your normal cycle. So that is also one of the cause of the amenorrhea. Sudden weight gain or loss. So suddenly you may increase your weight, or there is a sudden loss of your weight that is also contributing to the cause of the secondary amenorrhea. Now, sudden loss may be of because or sudden gain may be of different reasons, and mostly it is related to hormonal imbalance. Next one is stopping of your birth control. So many a times women stick to some contraceptive methods, basically in terms of taking the tablets or taking some contraceptive injections. And when they stop that particular process and when they want to conceive, then definitely it takes the particular body to regain all the things back to to the normal position. And it takes a substantial amount of delay in getting your period, and that may also last about 6 months. So that can also be, so doctors also needs to take into account whether a patient was taking or was on any birth control method or not, and that could be a reason for the secondary amenorrhea. Other reason why you may not get your period is pregnancy, as I told you before, is once you're conceived and you're pregnant, definitely you are not going to observe your period for almost next 9 months. And as such, that is also a condition of secondary amenorrhea. Of course, in pregnancy, after you deliver it further the period is also delayed by another 3 months. So almost once you conceive, and if everything goes fine, definitely you may see your period almost after 1 year. 9 months for delivery, and after your delivery is in the 3 months your body may take to get back the things to the normal. So these are the symptoms of the primary as well as the secondary amenorrhea, wherein the important condition is you have of the primary amenorrhea, you have not seen a period at least once. Here you have seen a particular period, but then they got suddenly stopped and you are not seeing them for almost 6 months. So possible causes could be this here, and possible causes could be this at this level. Of course, there could be also overlap of some of these cases. The secondary amenorrhea in adults. Now, when I say the secondary amenorrhea in adults, this is basically what I mean is in the age group of 30 and plus, because they already had their particular periods, and then the period suddenly stopped. As such, they fall under the category of secondary amenorrhea. So first, as I told you, is premature ovarian failure. So sometimes there are cysts or there are some ovarian cancers because of which the ovary may not function properly as it is supposed to be. And the reason also it can be endometriosis, wherein the excess matter gets developed in your ovaries, also on your fallopian tube inner and outer lining. So what is endometriosis? I already explained in my previous video. So it is basically the growth of the extra matter where it is not supposed to grow, and that may result in failure of some of these particular organs. Other thing is pelvic inflammatory diseases or reproductive infections. So there are many infections also associated which may prevent your normal particular menses or the blockage of the menses. So some of them it could be the vaginal infection, some of them can be your uterine infection, some of them can be urinary tract infection, and some of them also it can be the fibroids. So these are the excess mass that is produced inside your uterus can also result in prevention of your periods. So your pelvic inflammatory diseases or reproductive infections, they come in different categories at different locations. So some of them are vaginal infections, then UTI infections, then your fibroids which are generated inside your uterus can also be classified as a part of this. And you can have a look at it based on some medical tests as well as some scans. The next one is stopping of your birth control. As I told you before, that when you switch over from your birth control to the next regime, wherein you try to conceive, definitely your body takes some time to regain the balance. As such, you may find a delay in the period. Pregnancy, as I already explained extensively before. The next one is breastfeeding. Is whenever a particular woman after delivery is on breastfeeding, then definitely that there are good amount of chances that she may delay her pregnancy, delay her menstrual cycle, because to produce the breast milk, there are some hormones which are responsible, and their levels shoots up because they are constantly producing the milk for the particular baby. As such, it may result in the hormonal imbalance among the other ones which I listed down before, and as such, you may find a delay in your menses. Now, I would also like to mention the hormone that is responsible for production of the milk is prolactin, which I have not mentioned before in the previous slide, because in the previous slide we were discussing only about the hormones related to our menses, whereas this prolactin is a hormone that is responsible for the generation of your milk and also the development of your lymph nodes within your breast, which is ultimately producing your milk supply. And a good test that we can also do for this is the LAM test. Next reason why you may find irregularity in your periods is you are approaching your menopausal phase, wherein your menstrual cycle will be stopped permanently. So this usually occurs in the age group of 45 to 48 to 50 plus, and it varies from place to place. So details of this I also again spoken in my first video. Here I have listed down some of the changes that a woman who is in the menopausal phase may feel. So this is the phase wherein her periods are almost going to be sort of irregular till they stop permanently. So what are the changes that happens? The first thing, the symptom that is observed is changes in the mood swing. That is possibly because your pituitary gland, which I told you before, is basically located here. And now always in the ovulation phase of a woman, the pituitary glands were constantly sending the signals to all your other particular parts of the body to generate the different hormones and to bring about your menstrual cycle. But as you approach to your menopausal phase, now the pituitary glands has to work out the other way around and tell your body or tell your other particular parts, now it's your age to stop menstruating. And as such, there is no need of the production of these particular hormones to that level. And as such, you need to now work in a different particular way. So this may result in generation of also mood swings. So many women who are going into a menopausal phase observe a lot of mood swings. And many times the issues comes with the couples that we are almost in a fighting particular sort of position or some sort of misunderstanding. And it is quite obvious because the woman body is undergoing through a lot of the changes internally, and mood swings are quite common during this phase. Other thing that the woman may also observe is thinning the scalp hair. So definitely she may find some of her hair which was thick now has become a little bit of the loose, or it may have become thin. And also the thickness or the power of retaining the hair on the head or on the scalp has also reduced. The other thing is less of elasticity. Definitely you will find a less of elasticity and thinning of your skin. Your skin, which was in your adolescent phase, now tends to become a little bit loose and more elastic. So these are also the changes that you see in your menopausal phase. Second thing, other thing that you also observe significantly is the sagging of your breast. So you may find there's a significant amount of sagging of your breast that can take place, and this particular area that you see here will also get sagged along with your waistline. The other one that you see is amenorrhea, that is, you will find missing of your particular periods henceforth. So it is sort of the things that we are seeing in amenorrhea that may also be quite common, because henceforth you are not going to see your periods anymore. And this particular phase happens gradually. It is not that suddenly in the next month you will stop your menses. So you may subsequently you may find your menses flow is going on decreasing every month by one, or sometimes you may start getting sort of irregular periods within 1 month, 2 months or so, and then gradually they may stop. You may also find a substantial amount of change in your heart, and if you are a heart patient or something, then this is also plays a critical role. So you need to inform your doctor or cardiologist that you have reached a menopausal phase, wherein if you have any heart problem, he may advise you some other medication in this particular phase. And the common that is also found is osteoporosis, wherein the woman starts to lose the calcium in her body drastically to some extent. That's why it is always advised for a woman above 40 to have a good intake of the calcium diet in order to tackle this particular phase. So your bones are becoming more brittle, and as such, with a small fall and all, there are more chances of getting a particular fracture. Second thing, you may also find a urinary inconsistency. You may find inconsistency in passing the urine. You may find that your bowel, your particular bladder is full in a very short span of time, and you want to pass the urine again and again. So at that time, there are many particular causes also to it, and a woman is also more prone to urinary tract infection during this particular phase, as well as some sort of the vaginal infection. So if I observing like burning sensation in passing the urine, you're feeling a pain over here, you're feeling constant urination, then definitely some urine analysis needs to be done, and a proper treatment can be given to prevent this. So these are some of the common symptoms that a woman in the menopausal phase may encounter. Further, we go to the other extreme of menorrhea, wherein you have excess bleeding, and definitely this is the image that I took, wherein you may see your pads, something like this, totally filled with the blood. And the first thing that we do is we immediately remove them and throw it in a particular dustbin. So remember that particular slide which I showed you. Please have a detailed look at it before throwing it in your dustbin. Okay. Now, what is menorrhea? And menorrhea is basically a heavy bleeding. So as we had seen, the particular in that particular window, a normal particular bleeding usually can go up to 6 to 7 days. But if any woman is bleeding and it's bleeding heavily more than particular 7 days, then definitely it's a need of concern, and definitely needs to report to the doctor immediately. I've seen a particular some patients come to me after bleeding almost for 1 month, and then a lot of blood loss has taken place. The woman becomes more anemic, and once you become more anemic, you are more prone to catch other infections. So any bleeding above 7 days, you need to immediately report to your doctor. And also if you observe some changes in terms of your bleeding patterns, like the clots, or there is a more brownish discharge that was not usually observed in your previous periods, then definitely also report to your doctor immediately after 7 days. So basically what causes this is there are imbalances in hormone levels, especially the estrogen and progesterone. And if you remember, In my previous slide, I told you the importance of your estrogen and progesterone. Because if you see, progesterone basically is contributing when your lining is becoming developed. So if there is an imbalance in this, there are chances that this lining may grow much bigger, and definitely it takes a lot of time to shed off all this particular lining. And that could be one of the particular reason when this estrogen and progesterone imbalance is created, you tend to get more of the menorrhea rather than the amenorrhea. Other one, the ideal particular thing is vaginal infection. Many times, many women get the vaginal infection because of different reasons. Here, I would like to highlight two things: is always try to keep your vagina clean. There are different ways of doing it. Some of the women try to just use the soap for cleaning it, which is the same soap that they use for bathing, is not an ideal soap to clean your vagina. There are different ways. You can get something called a vaginal or feminine wash from your pharmacy. Try to get the herbal feminine wash. And what you can do is with that, you can clean your particular vagina at least 2 or 3 times a week if you don't want to do it every day. So it is like a shampoo wherein you need to add a little bit of water, prepare the foam and apply it at the vaginal area, and then wait for some time, let's say 1 or 2 minutes, and then flush it off with your water. So only try to apply it from the outer region, don't take it inside, and wait for some time and then clean it thoroughly with the water. It's good enough to prevent most of the vaginal infections. Some vaginal infections are created inside and they have the symptoms like you may find a lot of discharge, that is odor. You may find yellow discharge. You may find a lot of sometimes a sort of a brownish discharge as well. So these are all possible causes of vaginal infections. Sometimes you may also find a pain in your abdomen. You may find a fever. So all these things is to be treated thoroughly, and you need to report to the doctor immediately so that you can be treated on time before it spreads. Also try to keep your vagina clean during your menses phase. That is most important aspect as well, because many times unhygienic conditions results also in proliferating your vaginal infections. Other cause of this is inflammation of the cervix. So cervix, which I told you, sometimes get inflated, and as such, that can also result in excessive bleeding. Other one is the thyroid. So if your thyroid gland is producing less amount of the thyroid hormone, we basically call it as hypo, and basically underactive thyroid gland, which with the condition we basically call it as hypothyroidism, may also result in excessive bleeding. Whereas the absence of the period is caused by the hyperthyroidism. The excessive particular bleeding is caused by hypothyroidism. So which I already explained you in the previous slide. Other particular reason also, as I told you before, is can be because of the fibroids. Now fibroids is an excess mass that is been developed either in your ovary or it is basically developed in your uterus. So they are basically sort of the tumors. The first thing that idea that comes in our mind once we say tumor, it is going to be cancerous. It's a cancer, but it need not be. This particular are also sort of tumor. Tumor is nothing but excess growth, which it is not supposed to be, but they are non-cancerous and they are present in the uterus, and which we basically call it as the fibroids. So if you have fibroids in your particular uterus, then definitely you are also bound to get some excessive bleeding that is happening in your blood, in your menses, and that may result in your case of the menorrhea. So this is about the menorrhea, and these are possible the reasons why you may get a particular menorrhea. But immediately in case of menorrhea, immediately after 7 days, if you still see the bleeding continues, immediately report to the doctor so that he can treat you before it's going too late. Because ultimately you are losing a blood, so you are making your particular body more anemic. Now I would like to highlight some of the tests that can be done to handle amenorrhea as well as the menorrhea. The one simple test that is being prescribed is a blood test which takes care of your hormones. It identifies the different hormonal levels in your particular body. So a simple blood test for FSH hormone, LH, and all the remaining ones, estrogen, progesterone, can be done through a simple blood test. And this is quite a common particular test which is recommended by most of the doctors wherein these symptoms are observed. Next test is the PEP test, which we also call as the PEP smear test, wherein a small thing is inserted through a vagina and a swab is being taken from your cervix, and then it goes for the culture, and we try to identify if there are any particular infections or anything of that sort observed over there. That could be a cause for the menorrhea, basically, or also the amenorrhea to some extent. The other particular method is ultrasound. So this is basically a sort of a scanning is being done, and that basically gives a clear indication of what is going inside. Next one is magnetic resonance images, MRI scan. So if ultrasound doesn't give a good effect or still some complications are seen, then basically we go for MRI scan, wherein it gives a three-dimensional effect or imaging of your each and every particular part inside, and it gives a broader picture of the inner things, what is going inside your particular body in terms of the different organ. So we may recommend MRI if you have any doubts with ultrasound. Or sometimes based on these two tests itself, we know whether there is a need to go for ultrasound or MRI. Many times the doctor first prescribe ultrasound, then followed by the MRI. But if a good experienced doctor based on this test and based on the general checkup can tell the patient whether it's ideal to go for ultrasound or to go for MRI. Next category, we also have laparoscopy, wherein what is done is small incision is done in the abdomen, wherein a tube, laparoscopic tube is inserted, and through that we can get the different components. If we want to take some sample from your uterus or from your ovary, that can also be done, but it requires incision to be done on the body, whereas these first two tests are just done a scanning outside your body. So here small holes are done at your abdomen, maybe two or three based on requirement, and a tube is inserted inside it, and then the different examinations is done. There is also camera attached to it, and there are also some sort of the scissors that to extract the material if is required, or some sort of operative surgery that needs to be done in terms of your removal of the blockages in the fallopian tubes, or if there is some fibroids in your particular uterus and so on. To some extent, this surgery is more effective in doing it. Basically, working out with the ovary and the fallopian tube, we can go for the laparoscopy. And also to get the internal structure of it, the laparoscopy surgery is preferred because it involves minimal invasion in your particular body. The next one is biopsy, wherein biopsy basically refers to where removing some small piece from inside your particular body and then trying to send it for the examination. So this can also be done through. So there's something called as a vaginal biopsy, wherein a particular thing is inserted from the vagina. It goes from your cervical area to the uterus, and then we can take some of the samples from the uterine lining and so to check for the fibroids or whether they're cancerous or non-cancerous. We basically tell the patients to go for the vaginal biopsy in those cases. And of course, dilation and cartilage is nothing but extension of your particular vaginal area and your cervical area. So there are also procedures for doing it, but these are a little bit of operative procedures like laparoscopy, biopsy, dilation, and cartilage. They are operative procedures, whereas these two are done in your lab, which requires scanning, and this is also done at a clinic, but it is not an operative procedure. It can be just inserting a particular sort of uh, needle, not a needle, I would say the tube inside your particular vagina and taking the sample from your cervix. And this is itself is a blood test which you can do it in the lab. Now, what are the factors that determines what kind of treatment regime that you are going to follow? So based on these reports that have come up, the doctor may suggest you a possible treatment for your particular disease. And what are the important factors that needs to be considered in this is first of all your age and overall health and the medical history. So if you are young, then you can be treated with less of these particular procedures. You may not go to an extent of laparoscopy and biopsy to that extent based on the age factor, and also based on your overall health parameters and the medical history, provided you don't have any previous medical history problems, then appropriate treatment can be decided by the doctor. The other one is the extent to which the condition has deteriorated. So to what extent your condition is worse. So that's why I'm telling you, the more earlier you go to a doctor, it is better for him to diagnose and give you the right treatment. If you go late, then the extent of the condition, it becomes more worsen. Next one is the possible cause of the condition. So sometimes there are overlaps, there are multiple conditions that results in one disease. So you need to identify the probable cause based on this particular test and try to come up with the treatment regime that suits that particular patient. And what are your current symptoms and what are the symptoms that you are observing at that particular point of time. They need to be addressed first, followed by some supportive medicine so that it doesn't occur in the future and all. And your tolerance for specific medication. Now, as I again saying that many times many patients refer to the internet to find out for the medicines, and they sometimes try to take those medicines without the intervention of the doctors. So that should not be a good practice, because many times medicine that work for one patient may not work for the other patient, because each patient is different, each patient's body is different, their symptoms are different, their medical history may be different. As such, the doctor has to take into account all these parameters and try to decide a proper medical prescription for you. And also, there are cases wherein if the doctor gives you one particular medicine, you may also observe some side effects for that medicine. So immediately report back to your doctor so that the doctor can make the alterations in the medicine and give you the alternate medicine. So your tolerance, how your body reacts to the specific medications, the procedures or the therapies also determines what regime the doctor will follow to treat this particular disease. My next particular slide is almost, we are moving to towards the end. What are the good habits that can prevent you from having this? Always my first thing is having a balanced diet. When I say balanced diet, have a good intake of vegetables, have a good intake of the fish and other components, the protein diet, have a good intake of the meat, but try to avoid the red meat as far as possible. The pork, beef, all those things to maximum extent needs to be avoided. They can be replaced by something like the chicken, which is much easier to digest compared to the other two. Next one is restrict the intake of fat. So basically the fat is contributed in your body through the, basically because of eating of lot of junk food. Then your red meat I mean of the goat, of the beef, pork, all these things comes as they are very high in fat. So try to avoid it. Other thing, many times I found that many particular patient that approaches me, even in the adolescence phase, they are more fond to eating cheese in any form. The cheese may be present even in pizza. They are addicted to the pizza, which has a very high intake of the fat in terms of the cheese. So try to avoid intake of it. You can have a minimal particular piece just for your satisfaction, but try to avoid the majority chunk of it. Then you need to constantly exercise, because moderate exercise is a good regime to activate all your particular body parts. So have at least, I would say, 30 minutes walk every day in order to keep your all endocrine system working in a proper condition. Because when you walk, when you exercise, when you burn the fat, and when you are actually stimulating your muscles, your entire endocrine system gets activated, and as such it helps in giving a good effect also to the particular medication that is given by the doctor. You cannot simply take the tablets and just sit at home and expect the particular tablets to do the job. It requires also some effort from your side to activate, and those tablets will be additional particular help that your body will get in order to overcome the particular disease. So these are the things what you need to follow from as a person perspective, and the previous one the doctor will take care of. So exercise is a must, and definitely minimal, especially for the woman. Try to have at least half an hour walk every day, or if you cannot do it, split it into 15 minutes in a particular day or so, and try to at least do some exercise that keeps your particular body more active. Restore and maintain a healthy weight. So this is very important, and this can be ultimately controlled through your exercise pattern. Of course, many girls nowadays also go to the gym and do the workouts. It's a good thing that I see. That's why I call the today's girl or today woman as a modern woman of the next century. So always maintain a good healthy diet and a weight. And basically you can always compute your weight once in a month or once in 2 months. and try to find out where you are. So here what we basically call it compute is the body mass index. So BMI, what we call, is you take the ratio between your weight and your height, because your height by now is not going to change any further until unless you are in adolescence phase, wherein also there is a slight change in your particular height. But once you reach about 18, definitely height remains constant. So height will be a constant, but only what is going to change is your body weight. And try to find that ratio and find out whether you are in a permissible limit or not. If it is higher, that means you have gained more weight and you need to perform this particular steps to reduce your weight. Sometimes the weight increase may not be only because of eating habit. They may also be because of the hormonal imbalance. So if your thyroids are not thyroidal hormone, if this is not proper, it is also resulting in an increase in your weight. So that particular checking also needs to be done, and a proper treatment needs to be addressed. Find a way to deal with the stress. Now, stress is also contributing importantly in controlling your endocrine system, and definitely that's where many times we get the cases of amenorrhea and the menorrhagia. So the stress may be related to the family stress, it may be a work tension, or maybe other stress. So I always tell the couples that whenever, or for that matter any particular girl as well who is having this problem, try to overcome your stress and try to remove everything from your mind. That is a good indicator that you relieve your mind free, so that the mind can focus on the normal functionality of it, and the endocrine systems will also be activated in a proper way, and that will take care of your other parameters and other problems. So these are all the things that can be done at your end as a woman. And other things that which I mentioned is the lookout of the doctor, wherein the doctor intervention is required. Also maintain a healthy lifestyle by avoiding cigarettes and alcohol consumption. So definitely if you are consuming the alcohol or having the cigarettes, then please try to avoid it, because it is not going to solve your problem, it is going to make the things worse. One more thing I would like to add here is, instead of the alcohol, if you can also have something called as a wine, grape wine or a black wine, what we basically call, you can have a little bit consumption of it, maybe say half glass per day or something. It is found to be good for a woman rather than this alcohol and cigarette. And of course, the alcohol level in the particular wine is absolutely very low. So that way it is not going to harm, but it is also going to affect the other endocrine system, and also it's good in maintaining a good cholesterol level and other components. So you can have a particular half glass of it every day, but it has to be a black wine, which has less of a particular alcohol content, and it's basically prepared from the black grapes. So if you can get it at your particular area, then definitely you can have the consumption. Even the men can also have it instead of having alcohol and particular cigarette. So these are the good healthy habits which everyone should follow. This is are also common for a man as well. And specifically, since we had a topic on menses, then I triggered it more towards the woman-centric approach. So try to have this particular good habits in your life, and this may, to a majority time, can handle or solve the problem that you are facing of irregular menses on its own. So those problems are basically generated because some of these things were not followed in your adolescence phase, and they simply triggered the imbalance in your hormone, and that has resulted in those kind of problems. So if you just maintain this particular habit always, then definitely most of the problems you can get a solution to it without even going to the doctor. So that almost brings to the end of my slide. I would like to thank you for listening to my presentation. And here is just a list out of how to reach me. So if you want any particular, if you have any doubts and if you want to clarify it, or if you have any personal problem which you want to ask me for the doubts, then definitely you can contact me at this particular location. Again, I would like to mention that I'm providing free consultancy, and all these lectures that you see are free of cost. Only you need to have the internet connection. I also do give live sessions like this, and the link that you can find it over here. So the first thing is, you can reach at me on the Facebook. So my name is Tanvin Dias. I also have my own Facebook group Dr. Stanwin and Dr. Steffi. Dr. Steffi is my wife, but she's not associated with the gynecology. But definitely we have a common group. So whenever I'm not present, I could not give enough time for the group. She handles it and just informs me about the any problem the patient has put up, and then I can get back to the patient. So we are about managing basically our gynecology group, but she's a cardiologist and not related to a gynecology. Then I'm also part of Dr. Gynecologist group, which so this is not owned by me. This is totally my group, and also I'm admin of this group. So you can also join me through this particular group. But more prominent, I would say, is my first one, wherein I constantly interact with the people all over the world. You can also reach me at YouTube. So all this particular, I have a channel itself that is Dr. Stanwin Dias, your gynecologist. And this particular video will also be put up over there, along with I have also done the recording of the other videos. So all my videos you may find here on YouTube channel. And also I have a WhatsApp group, but I would not like to share my number here, but you'll be first part of this groups, and then through our interaction, first level interaction, then if there is a need and based on the seriousness of your problem, I would like to share my WhatsApp number with you, so that some patient which requires a constant care, then I give my number to them so that we can be in touch at any given point of time. So these are the particular things how you can reach out to me. So by you can use any medium for doing it. Also the live sessions which I give, I have a Zoom link, and definitely that particular link is also being put up on my group, that is Dr. Stanwin and Steffi of Gynecologist group on Facebook, as well as on this group also my links have been put up over there. So I would like to thank you, each and every one of you, for being patient and for watching this particular PPT. Have a nice day.